Welcome to our public webinar from the SGH Department of Nuclear Medicine and Molecular Imaging. Today, our topic would be on nuclear medicine and hyperthyroidism. And we have two speakers today. First is Dr. Chua Wei Ming, who will be giving the talk in English, and then it will be followed by Dr. Ku Sixuan, Gu Sixuan 医生, and she will be doing her talk in Mandarin. OK， 欢迎大家来到我们新加坡中央医院核医学和分子影像部门的这个研讨会讲座。今天的题目是关于甲状腺机能亢症。我们会有两位医生给大家讲解。第一位是蔡伟明医生，会用英语跟大家讲解。接着就是顾思璇医生用华语跟大家演讲。Okay, I think without further ado, we will start with Dr. Chua Wei Ming.
So I'm Wei Ming, Associate Consultant at Nuclear Medicine, and it's a pleasure to be here to talk to you about nuclear medicine and hyperthyroidism today. So this is the outline of my talk. We'll start off with a brief overview of the thyroid gland and its functions, and then we will then dive into what hyperthyroidism is, what are some of the symptoms and complications you may encounter, how we diagnose and treat hyperthyroidism. We then divert our attention to introduce to you my department, nuclear medicine, and to also maybe clear some of the misconceptions you may have about nuclear medicine. And lastly, we'll finish off with radioactive iodine treatment, which is a treatment we offer here at Nuclear Medicine for hyperthyroidism. So the thyroid gland is a butterfly-shaped organ in the neck, located just below the Adam's apple or the thyroid cartilage. It is one of the many different endocrine organs that we can have in the body. So the endocrine system is basically a collection of different glands that produce different hormones. And these hormones act as messengers to deliver signals or messages across the body to control bodily function. So for the thyroid gland, they produce thyroid hormones, which we can divide into two different types of thyroid hormones, and we can actually just simply call them as T4 or T3. What does thyroid hormone do? So it actually regulates our body's metabolism, which determines how our body transforms food into energy and how our body utilizes this energy for the different bodily function. And because all of our organs require some form of energy, it affects virtually every organ in our body. And these are just some of the examples of the different organs that thyroid hormone may affect. So for example, in the brain, it can affect how fast we process information and our mood. It can also affect the liver function, how fast we are breathing, how fast we digest our food, our bone health, menstrual cycle, how hard our heart is working, and our body temperature, as well as muscle development and contractility. So because it affects almost all of the organs in the body, it is important to ensure that the thyroid hormone is regulated and is at a stable and normal level. And how do we do that? We do it by using this other hormone called the thyroid stimulating hormone, which is produced in the brain. So you can think of the brain as like a control center, and it sends signal to the thyroid gland. So this signal comes in the form of the TSH. The thyroid gland receives the signal and then will then start producing thyroid hormone. At the same time, the brain will detect the level of the thyroid hormone in the body and then adjust the TSH or the signal accordingly to regulate the thyroid hormone. So this is almost like a thermostat system that we have in our house. So if there's a desired temperature that we want to set the room temperature to be at, and the temperature is detected to be below this temperature, this desired temperature, the thermostat will then turn on the heater to increase the room temperature. But let's say if there's excessive amount of heat that's being produced such that the temperature rises above the desired point, the desired temperature, the thermostat will then turn off the heater to stop producing any more heat, and this will then decrease the room temperature back towards the desired temperature. So this is how the thyroid system work in our body. And you can imagine that if the feedback loop malfunctions, you would end up with either too high a thyroid hormone, which is hyperthyroidism, or too low thyroid hormone, which is hypothyroidism. And for the talk today, we are concentrating more on hyperthyroidism, which essentially is an overactive thyroid gland that produces an excessive amount of thyroid hormone. And this affects up to 1% of people globally. It is more common in women, affecting 4 to 7 times more compared to men. The most common cause is Graves' disease, affecting 70% of people with hyperthyroidism. The other two common causes include toxic adenoma and toxic multinodular goiter. So if you look at the right-hand side of images, the far right, you can see a set of images of a thyroid uptake scan that we perform at Nuclear Medicine. And this essentially shows how active the thyroid gland is on imaging. So essentially, the black areas represent the overactive portions of the thyroid gland. So if you look at the first set of images, Graves' disease, you can see the entire thyroid gland is black, and it essentially means that the entire thyroid gland is overactive. Whereas for toxic adenoma, the problem is a solitary overactive nodule that is producing too much hormone, whereas the rest of the thyroid gland is actually normal. And for toxic nodular goiter is when you have one or more than one of these nodules producing excessive amount of thyroid hormone. So if you do have hyperthyroidism, what are some of the symptoms you may experience? Because thyroid hormone controls our metabolism, hyperthyroidism would mean that your metabolic rate is high. And this may explain some of these symptoms over here. So hyperthyroid patients may experience anxiety, nervousness, or they may become easily agitated or short-tempered. And because their brain is overactive, they may have difficulty sleeping. And paradoxically, if this disrupted sleep goes for a long time, they may then become very tired after that. And because your heart is working harder, you may start to become aware of your heartbeat, which equates to heart palpitation. You may also have hand tremors. And because your metabolic rate is high, you get unintentional weight loss, even though your appetite has increased. And your gut is working harder, so you may find that you're going to the toilet more often. And because your body temperature is higher, you may feel hot all the time. And your body will then try to lose the heat by sweating. So you may find that you sweat more often. And other symptoms may include muscle weakness and, of course, enlarged thyroid gland because the thyroid gland is overactive. So there is a severe form of hyperthyroidism which we call thyroid storm. Basically, it's an exaggeration of all of the symptoms that I mentioned earlier. So if you do have any of these severe form of symptoms, please seek medical help more urgently so that you can receive medical care. Let's say if you have known hyperthyroidism. What are some of the long-term complications that you may have if you are hyperthyroid? So because your heart is working harder and faster than most regular people, you may eventually develop irregular heartbeat. And over time, the heart cannot cope with this stress and they may then fail. So this is what we call heart failure. And people with hyperthyroidism may also experience fertility issues. Their bones may weaken, leading to them developing this condition called osteoporosis. And in patients with Graves' disease, they may also get what we call thyroid eye disease, which you may see sometimes patients have these bulging eyes that we see. So if you have hyperthyroidism or hyperthyroid symptoms, how do we diagnose you as hyperthyroidism? Usually the doctor will order a thyroid function test, which is a blood test that measures the level of thyroid hormones in the body. We also measure the level of thyroid stimulating hormone, which is the hormone that I mentioned earlier that is produced by the brain. And this blood test is sufficient for us to diagnose hyperthyroidism. Often we also include thyroid antibody tests, which test for Graves' disease, because Graves' disease is an autoimmune problem where the immune system develops antibodies against its own organs. And sometimes the doctor may also order imaging or some scans to image the thyroid, for example, ultrasound or thyroid uptake scan, which you have seen earlier. So how do we treat hyperthyroidism? The first line treatment, or most people start off with what we call anti-thyroid drugs, which are prescribed by endocrinologists. And I have listed the more common medications over here. The other two options are surgery and radioactive iodine, which nuclear medicine offers. But before I dive into radioactive iodine, let us learn more about what nuclear medicine is. So although we share the same word nuclear as nuclear bomb, we are not the same. So please don't be too afraid of us. We both deal with radiation, both nuclear bomb and nuclear medicine, but we actually deal with radiation in a safe and controlled manner. And we use this radiation to diagnose and treat diseases. So basically, we use radioactive drugs to assess organ function and then to diagnose or treat diseases. And we can actually image various organs in the body, and I just listed a few over here. And in terms of therapy, we treat cancers as well as hyperthyroidism, which is the focus of this talk. So are we similar to radiotherapy? We both deliver radiation, but in different way. So for radiotherapy, we actually shoot the radiation beam from outside of the body into the body. So there is a radiation beam coming externally. Whereas for nuclear medicine, we actually inject the radioactive medicine, or we can also consume it orally. And this radioactive medicine then localized to the areas that we want to treat and deliver the radiation there. So because we can produce medicine that target specific cells for treatment and imaging, we can avoid delivering radiation to non-target cells. So for example, in the case of hyperthyroidism, we want to treat the thyroid gland. So we can actually manufacture a specific drug that carries radiation, and this drug will then localize to the thyroid gland to deliver the radiation without affecting other organs like the lungs or liver, for example. And we can also determine how much radiation we want to give. So if we give low radiation, we can use it for imaging. If we want to treat the patients, we usually give a higher radiation for treatment. So for radioactive iodine, it is actually given as a drink or capsules. Usually nowadays we give as a capsule because it's cleaner. After you ingest the radioactive iodine, it will be absorbed into the body through the digestive system, and then it will localize to the thyroid gland, where then the radiation will destroy the thyroid cells. So who should receive radioactive iodine? Usually people who are referred to us for RAI treatment are those with major side effects from the anti-thyroid medications that they have been taking, or perhaps the anti-thyroid medication is not able to control the hyperthyroidism. And of course, if you do not want to undergo surgery, or if you are not able to undergo surgery because of medical problems, radioactive iodine is a good alternative. Who shouldn't receive radioactive iodine? So because the treatment involves radiation, if you are pregnant or planning to conceive in the next 6 months, usually we will advise you not to undergo radioactive iodine. If you are breastfeeding, we will also advise you not to undergo unless you are okay to stop breastfeeding after RAI, because the iodine can actually come out in the breast milk. If you have thyroid cancer, usually you would require surgery first, and then you may then receive iodine after the surgery. And there's this, as what we mentioned earlier, there's this group of patients who have thyroid eye disease, and if they have severe thyroid eye disease, we may actually advise them to go for alternative treatment other than radioactive iodine for reasons which I will come to later. So how do you prepare for radioactive iodine? Usually, we will require you to undergo low iodine diet for a short period of time around the radioactive iodine period. This is to prevent the radioactive iodine from competing with other sources of iodine to be absorbed by the thyroid gland. So as to optimize the amount of absorption of the radioactive iodine by the thyroid gland. We may also require to stop any anti-thyroid medications before the treatment itself. So this is how you would take the medication. Here you have this test tube shape or test tube thing that the capsule will be placed into. And then what you do is to tube the capsule, the test tube towards your mouth, and then let the capsule drop into your mouth, and then you swallow the capsule. There is water given to help you to swallow the capsule, and after which you can go home. So it's an outpatient treatment. You do not need to stay in hospital, and it's a fairly straightforward procedure. After the radioactive iodine, usually we would require you to take some precautions. For example, avoiding crowded places or avoiding prolonged contact with pregnant women or children, sharing a bed and utensils, and so on and so forth. But usually this is just for a short period of time to minimize the radiation exposure to the public. And of course, if you are female, usually we would give you advice to avoid pregnancy for 6 months, and for males to use contraception for about 4 months. What are some of the side effects of radioactive iodine? Usually because there may be some inflammation at the thyroid gland, you may experience some pain or tenderness at the site of the thyroid gland, which can also manifest as sore throat feeling. There may be a transient rise in your thyroid hormones because the thyroid gland is being destroyed and inflamed. So all these thyroid hormones that are stored in the thyroid gland may start to leak out for a short period of time. And because there's a rare chance that you may develop or new or worsening thyroid eye disease, that is why it's important for us to always assess your condition of the eyes. And if we feel that the thyroid eye disease is severe, we may either refer you to ophthalmologist or advise you to consider alternative form of treatment. But I have to emphasize that this side effect is actually rare. So if you do not have any thyroid eye disease, or you only have mild thyroid eye disease, actually radioactive iodine is still safe to take with certain precautions that we can use to minimize the worsening of the thyroid eye disease. And of course, there is no significant risk of cancer, because people may be worried if they are exposed to this amount of radiation, will there be an increased risk of cancer? The amount of radiation we deliver for treatment of hyperthyroidism is usually fairly low, so there's no significant increased risk of cancer in general. So how effective it is? Usually about 85 to 90% of patients will be successfully treated after 1 dose of RAI, and most of these will become hypothyroid. In other words, they will have low thyroid hormone, and they will require lifelong thyroid hormone replacement subsequently. A minority of patients, about 10 to 15% of patients, may require a repeat treatment, usually after a period of 6 months of monitoring. So I've come to the end of my section. I'll hand on over the time to Dr. Khoo, who will then deliver her talk in Mandarin.
大家下午好，我是思萱，来自中央医院和医学分子影像部门。 今天我将跟大家分享有关甲状腺功能亢进症以及和医学的相关性。这是我今天演讲的简要提纲。甲状腺位于颈根部喉结正下方，它是一个蝴蝶形状的小腺体，对身体的影响却很大。新陈代谢的每一部分都由甲状腺分泌的2种主要的荷尔蒙控制：甲状腺素 T4 和3-甲状腺氨酸 T3。甲状腺功能亢进症又称为甲亢，是我们平时俗称的大颈泡，它是甲状腺分泌荷尔蒙过多所致的。有可能导致甲亢的风险因素或状况包括格雷夫斯病，就是 Graves' disease， 自主性过度活跃甲状腺结节，就是 overactive 或 overactive 的 thyroid nodules， 还有甲状腺炎 thyroiditis， 3种主要原因。甲亢会加速人体的代谢，从而引起多种症状，例如心跳过快或不规律、胃口好却体重减轻、紧张焦虑、手颤抖、怕热、一直跑厕所大便、失眠等等。老年人更有可能出现难以察觉的症状，包括忧郁，以及在日常生活中感到虚弱或乏力。甲亢最严重的某些并发症涉及心脏，包括一种称为心房颤动的心律失常，会增加发生中风的风险；充血性心力衰竭、骨质疏松症，还有甲状腺炎病。甲状腺微象或甲状腺风暴是一种严重的疾病，患者可能出现甲状腺功能亢进症的极端症状，如果不及时紧急治疗，可能会有生命危险。诊断甲亢的测试包括甲状腺功能血液检查、甲状腺抗体血液检查 （thyroid antibodies）、甲状腺超声波 （thyroid ultrasound）， 还有我们和医学这边所做的甲状腺高德酸盐扫描。有时候我们会需要做这个特别的扫描来进一步确认甲状腺功能亢进症的原因。甲状腺亢进症的治疗方法有几种，抗甲状腺药物可以用来减少甲状腺分泌的荷尔蒙数量，有时甲亢治疗需要手术来切除全部或部分甲状腺，例如甲状腺肿大导致吞咽困难或压迫等症状。在某些情况下，甲状腺亢进症可能会在不使用药物或其他治疗方法的情况下得到改善。如今的手术可能不会像以前那样留下难看的疤痕了，但也并非没有危险。手术有它自己的危险性，例如附近控制声带的神经线不经意受损，导致声音沙哑。需要注意的是，抗甲状腺药物并不能治愈甲亢，只能帮助控制。这意味着控制可能不稳定，有时控制所需要的剂量会波动。抗甲状腺药物还可能产生有害的副作用，例如导致白细胞计数减少，使患者更容易受到严重的感染，或导致肝功能受损或严重过敏反应。正是由于这些原因，我们通常会建议患者，如果在某一段时期后还无法戒掉抗甲状腺药物，就应该考虑 进行放射性碘的治疗。而这就是我们核医学发挥作用的地方，我们提供放射性碘治疗。那什么是核医学？对于一些受过医学训练的人来说，它听起来很可怕，更何况是外行人。核医学是一门使用放射性碘物质来诊断和治疗某些疾病的专业。这是治疗诊断学领域，英文称为 Theranostics。我们的放射性药物可用于治疗一些恶性肿瘤，例如肝癌、神经内分泌癌、前列腺癌，以及一些良性的疾病，例如甲状腺功能亢进症或某些关节疾病。也许比核医学更知名度的医学专业就是放射肿瘤学，我们所谓的电疗。与电疗相比，放射性药物治疗可以把辐射直接传送到有靶标的细胞，理论上对健康细胞的损害就会更少。同样的，与化疗相比，核医学利用的放射性药物提供了更有针对性的治疗方法，从而减少对正常组织细胞的伤害。这是我们的放射性药物如何操作的简化说明。它们是由靶向分子 （targeting molecule） 与放射性同位素 （radioactive isotope） 连接起来的组成的。当放射性药物进入体内时，靶向分子就会在我们所要治疗的细胞上或细胞内寻找出它配对的靶标。targeted molecule， 然后将放射性同位素传递出去，对细胞发挥魔力，就是损害细胞。这张图片里，我们攻击的目标是癌细胞。那如果现在我们想要攻击甲状腺细胞过度活跃的细胞呢？我们就要把放射性碘输入甲状腺细胞，让它的辐射来摧毁过度活跃的细胞。我们利用放射性碘同位素 iodine 131，这并不是新奇的治疗方法，我们已经用这个超过80年了。在一些国家里，一开始治疗甲亢，第一线治疗就是用放射性碘，而在新加坡，通常在抗甲状腺药物失效后，才转诊使用放射性碘。它是口服药，吞入身体内就会把辐射带入甲状腺细胞，可以在门诊治疗，不需要住院。谁适合接受放射性碘治疗？主要是抗甲状腺药物不耐受或有副作用的患者，或者长期不能戒掉抗甲状腺药物的人。那么谁不适合接受放射性碘治疗呢？主要是孕妇或哺乳期的女人，还有严重甲状腺炎病的人，因为放射性碘有可能使甲状腺炎病恶化。放射性碘治疗其实很简单，只需要病人几天前根据一些指示，比如说4天前应该停止服抗甲状腺药物，也要保持低碘饮食，我们的放射性碘才会更有效的被吸收。当天来服碘之后就可以回家了。这是我们部门为病人放射性碘的房间。 服用放射性碘之后的指示，我们会在看病人的时候跟他们说，比如3天后可以恢复正常饮食，不需要继续特别低碘饮食了。最主要的是，治疗后的前几天到1个星期的时间内，不要跟孕妇和小孩亲密接触，多喝水，以频繁排尿来减少体内的辐射。尿便里也会残留辐射，所以用厕所时要特别注意抽水。口水里也会有辐射，所以不要亲孩子，也不要跟家人共用餐具。等等防辐射的安全措施，我们都会跟病人解释并写下来。治疗后其实隔天就可以回去工作了，因为通常病人不会感觉到什么不同，除非工作岗位上需要病人靠近孕妇小孩，那么我们就会建议这些病人等至少几天后才回去工作。女性们在治疗后的6个月内应该避免受孕。哺乳期的妇女也应该停止哺乳，直到下个妊娠期。放射性碘治疗的副作用通常并不严重，即使出现也是暂时的，例如甲状腺压痛或疼痛的感觉，喉咙痛或味觉可能短暂改变。因为放射性碘对甲状腺造成损害，所以甲状腺荷尔蒙可能升高几天，甲亢的症状就有可能复发几天到一两个星期。因此，医生会建议患者服了我们的放射性碘治疗之后3天后，重新开始服用抗甲状腺药物，持续几周。我们通常会在治疗后2个月内看到甲状腺荷尔蒙计数下降。放射性碘治疗后的复发率通常不高，大约只有10到15%的患者可能需要第2次的治疗。很重要知道的是，放射性碘治疗成功的定义就是患者变成永久甲状腺荷尔蒙低，会需要长期服甲状腺荷尔蒙的药。可是甲状腺荷尔蒙的药跟抗甲状腺药物比起来，好处就在于没有过敏性，没有肝脏或严重低血球等的副作用，可以说是比较安全，比较容易处理。我们今天的分享就到此为止，谢谢大家参加今天的讲座。希望我们已经让大家清楚地了解核医学如何帮助彻底治愈甲状腺功能亢进症。现在如果大家有任何问题可以提出来，我们会尽能力解答。谢谢。
Yeah, okay, so I'll start off answering the first question over here. So what is the cause of hyperthyroidism? As I mentioned earlier in my slides, the most common cause is Graves' disease, which is an autoimmune problem whereby your immune system starts producing antibodies against the thyroid gland, and these antibodies actually stimulates the thyroid gland and cause it to be overactive. There are some genetic predisposition for hyperthyroidism. So usually we will ask patients if they have family members who are hyperthyroid, but environmental factors are also important. And although some of the times we are not able to tell the exact cause, and they may just happen sporadically. Will it resurface again after remission? So it depends on how your hyperthyroid condition was treated if you are currently on anti-thyroid medications, which is not considered a definitive therapy for hyperthyroidism, sometimes it can resurface again, even though you are considered in remission. But if you have undergone a more definitive therapy, such, for example, surgery or radioactive iodine, the chances of remission, I would say, is very, very, very low. Yeah, I hope I answered that question. Would it be hard to conceive after doing RAI and taking the hormone replacing pill? And would the hormone replacing pill affect fetus development? So I would say that uh, we would usually encourage or advise you not to conceive immediately after taking RAI for at least a period of 6 months. That's because we usually require 6 months to um, stabilize the hormone levels. And actually, thyroid hormones are very important for fetal development. So if your thyroid hormone levels are not stable, it can affect the fetal development. So that's why we usually give you give the patients ample of time for their thyroid function to recover before we advise them to proceed to plan for family planning. The thyroid hormone with the hormone replacing pill itself doesn't affect fetus development. So it is actually essentially the same hormone that we have in the body. So by itself, it doesn't have any side effects. But of course, if you are over replacing or under replacing the thyroid hormone, then that may affect fetal development. So, and that's why we always encourage you to inform your doctor when you are trying to plan for family, when you want to start family planning, so that we can try to um, uh, optimize the thyroid function before you proceed for the pregnancy. Yeah.
这个问题其实没有，如果长期服用尤加乐，可是那个剂量是刚刚好的，不会太高，不会太低，那其实对身体不会有不良好的副作用，因为这是我们每个人都需要的一个荷尔蒙。所以其实我们放射性碘治疗之后，还会需要病人长期跟任何一位医生来复诊，要至少大概1年1次，检查那个甲状腺的血液检查，来确保那个剂量是刚刚好。
Why don't I think there's a question by Philip Ye asking why don't we use nuclear medicine as a first line treatment if it's more effective targeted treatment and less side effects. So usually they start off with anti-thyroid medications to control the hyperthyroidism, and then they let your own body try to so-called resolve the condition by itself. And in these cases, if it's effective enough, actually the most patients, if they are able to recover spontaneously on the anti-thyroid medications, they may not require long-term thyroid supplements during remission because their thyroid function recovered by itself. Once you take either the radioactive iodine or surgery, is quite highly likely that you will become hypothyroid. That means you can't produce enough thyroid hormone to sustain your metabolism, and then you will be required to take lifelong thyroid replacement. And that's why I think most people start off with the anti-thyroid medication first to see whether your body can recover by itself. And if it is not possible, then they will proceed to the more definitive treatment. So can hypothyroidism coexist at the same time as thyroid cancer? Will nodules in thyroid glands cause hypothyroidism? So yes, hyperthyroidism can coexist at the same time as thyroid cancer, although not very common. However, there are some evidence to show that people with maybe Graves' disease are slightly at a slightly higher risk of having thyroid cancer. And that is why sometimes if we find that you are hyperthyroid, we will also order an ultrasound to look for any suspicious nodules. And as mentioned earlier in my talk, some of these nodules can be also overactive and cause hyperthyroidism. And this is what we call the toxic adenoma or toxic nodular goiter. Yeah.
这个问题没有甲状腺的尺寸没有一个规定的尺寸需要手术治疗，是看患者有没有压迫症状，比如说影响吞咽。
There's one question by an anonymous attendee saying that after taking radioiodine, and you are now hypothyroid, why you would require lifetime medication? And I presume maybe the hormone may still be unbalanced. So basically, when we give you the radioactive iodine and it has destroyed the thyroid gland, usually the thyroid gland is not able to function properly, and therefore you will become hypothyroid. And as I mentioned earlier, thyroid hormones are important for metabolism. So you will require some form of thyroid hormone replacement to sustain your metabolic rate, which is important for your organ functions. And we have patients usually at first 6 months after treatment, because of all the fluctuations of thyroid hormone, because you are receiving the radioactive iodine, is causing inflammation, and then you suddenly become low in hormone when you were high initially. So the initial 6 months period may be quite unstable, but over time, I would say if we as time passes and as we monitor patients, usually it will become stable eventually. Yeah, so sometimes you just need to allow some time for the thyroid status to recover. Yeah.
Oh, sorry, I was in the midst of typing my answer. Generally, we feel that the most common cause is Graves' disease, which is an autoimmune condition that is very commonly hereditary. So family history of Graves' disease definitely is a risk factor for having hyperthyroidism from Graves. And other than that, overactive thyroid nodules or multinodular goiter, the family history does not play such a strong part. Yeah.
Multiple thyroids are they a concern for further evaluation? So usually if you have if you have some kind of thyroid lesions, usually we advise for ultrasound first to see how suspicious these cysts or nodules are. If they are not very concerning, we just leave them alone. If they have some features that are a little more concerning, sometimes we will just advise for follow-up, or they can actually do some kind of needle aspiration to sample the nodule to see whether there are any cause for concern. Yeah. But I would say actually thyroid lesion nodules or cysts are very common, and most of them are actually benign. But if you do have any of these, please seek a medical consult for further evaluation. I think there are some questions again on which the groups of people at higher chance of hyperthyroidism. So as mentioned, females are more likely to get. There are some genetic predisposition. Some environmental factors may also affect, for example, in areas of iodine deficient areas, but these are not areas that are not in Singapore, basically. So yeah usually I would say the strongest would probably be genetic and then some environmental factors. Yeah, as well as the female gender.
核医学也用于甲减，我们不会用核医学来治甲减。甲减是需要吃甲状腺荷尔蒙为了补身体没有不足够的甲状腺荷尔蒙数量。
There's one more question on whether it's okay to take anti-thyroid medicine long term if you don't have any negative side effects and your thyroid readings are stable. I guess yes, you can continue to take, but usually I would advise you to consult an endocrinologist because they are more familiar with it. There can be side effects from anti-thyroid medications. The more serious ones are of course quite rare and uncommon. But nonetheless, they may still happen. So I would suggest that maybe you consult an endocrinologist to see how long you should be taking them for. But we have patients who are on them for long periods of time as well, because there may be no other better alternative. Yeah.
There's a question about whether or not there's any steps that can be taken within your diet to prevent hyperthyroidism. The answer is that in a place like Singapore, where we have ample iodine in our diet, there is no particular prevention strategy diet-wise. In certain countries that have not enough iodine in the diet, iodine deficient countries, then in such places, the incidence of getting thyroid nodules that are overactive may be higher if they overeat iodine in their diet. But in Singapore, there is no particular precaution dietary-wise to prevent. There's a question about whether so female has higher chances to get this disease, but what type of people other than gender? And generally, I think the main risk factor is family history of Graves' disease or personal history of autoimmune diseases. Sometimes also is a risk factor for getting autoimmune conditions such as Graves'. As for thyroid nodules in Singapore, there is no, but I'm not aware of any risk factor that increases the predisposition to get overactive thyroid nodules. For thyroiditis, there are certain causes of thyroiditis that can, for example, in some patients after giving birth or sometimes after having a viral infection, or certain drugs like heart medication like amiodarone, then if they do get hyperthyroid after that, this is one of the things that they thyroiditis is one of the things that they consider possible as a cause.
Okay. I think thank you all for all the questions. I hope we have managed to answer most of them. 我们很感谢大家过去1个小时专心听我们的这个讲座，也很感谢大家的所有问题。我们希望我们都尽我们的能力可以解答到大家的疑问。如果有什么其他的疑问or if anyone has any more queries, you can also approach our patient liaison service, right? And there is this QR code that we would like to get your feedback on our webinar. Thank you very much.